I'm a sports therapist, physical therapist. I've been based in Midhurst for the last 30 years in West Sussex. So I have my own little sports injury clinic down in the Cadbury Ruins. Um, I'm a triathlete, so I swim, bike, run. I have 4 rescue dogs as hooligans. There's a lot of walking and a lot of running, and generally a very active lifestyle. So in the beginning of 2019, when I started to get medial knee pain, obviously I treated it conservatively and just thought, well, I'll rest it from running for a couple of months, um, thinking that I was superhuman and different from everybody else, that I would be able to basically rehab manually with no interference from anybody else, and all would be well. Things didn't go according to plan. And after 2 months, obviously the pain increased. At that point, I was no longer able to run. And I realized that it was sort of meniscus cartilage. So I think by then lockdown had kicked in, and I went and had a private scan with Vista Health. The scan came back, as it would do on a 56-year-old who's had that type of lifestyle, with lots of debris and fragments and cartilage. So I had an arthroscopy, but within 2 days realized that that was a curveball and that it was a little bit more serious. And that's when basically I went to meet Jonathan, more like Ginger than Black Beauty, and with my ears down and my tail in between my legs. I'd gone by that time into a very dark place in my brain, which I'd never been to before, because trying to cope with work and being now very lame and just wanting to get off your legs the whole time was just horrible, a horrible place to be. Anyway, so I went in to see Jonathan, and obviously he did a loaded x-ray, and it was very evident that I was bone on bone on the medial side. And, there was nowhere for me to go. All the manual therapy in the world was not going to reverse this. So when Jonathan offered me a Mako replacement, I jumped at the chance and, get me in as soon as possible. I have actually rehabbed quite a few of Jonathan's new knees, ACL replacements, and all sorts of other things. And so obviously shared quite a few clients for me, patients for him. And they've always been absolutely brilliant and a pleasure to work with, because he does such a good job that he makes my life really easy, rehabbing on the other side of him. So it's always great, taking on the patients back from him. So I never once questioned the new knee. It was Jonathan, so I just put my full faith in him. So I went to see Jonathan. It was all confirmed that I would go ahead with the operation. From start to finish with the operation, it was a pleasure being at the Fortius. Everyone was absolutely fantastic. I can honestly say, I don't think I had any pain from start to finish. And I don't like taking drugs. I don't like taking strong painkillers. And obviously there are 3 weeks worth of quite heavy anti-inflammatories, painkillers, aspirin, etc. So I was a good girl, and I took the aspirin and a lot of the other things I should have done, but I think I probably stopped taking. So I'm not recommending this at all, but I probably stopped taking the strong painkillers after about a week, because I just didn't need them. And throughout the whole process, I really just felt like I was healing a wound rather than rehabbing a knee. Prior to the operation, I'm completely obsessed with good posture and body alignment. And that's all really part and parcel of all my training for triathlon, with strength and conditioning, and you've got swim, bike, run sessions each week. So I made sure that before I went in to see Jonathan, I was as fit as I could possibly be, and everything was where it should be. And I suppose it was a surprise when I came out the other side that the operation where they're opening you up down the center of your knee, that wound is quite deep. So it was always going to be X amount of healing time for the actual wound. But so long as you do the exercises and you stick with the plan, it was very plain sailing. I got full range of movement back relatively quickly. I didn't really lose much strength because I'd held on to as much as I could before I went in. And I think I was out walking my dogs on the common within about 3.5 weeks of the operation. I think I did my first race 3 weeks ago, which was an aqua bike in the New Forest, which was just brilliant. There weren't that many in my age group, but I won my age group. I was third woman overall. I would recommend to anyone that, if they've gone past the stage of, manual therapy, rehab, manual rehab, if they have structural damage that's gone too far, and Jonathan has recommended a new knee, I think that it's life-changing. It can take you out of that dark place in your head and just return you to just your normal lifestyle.